Hi, my name is Dr. Kenneth Mack. I'm a child neurologist at the Mayo Clinic in Rochester, Minnesota, and I see a lot of patients who have headaches. And one particularly troublesome headache syndrome that I see is when patients have chronic daily headache. This is a very challenging headache syndrome to treat and can be very distressing for many of my patients. So, chronic daily headache is when patients have more than 15 headache days every month for at least 3 months in a row. Actually, most of my patients with chronic daily headache have headaches every single day, and sometimes 24 hours, 7 days a week, every single day for a matter of months to years. So you can see how that's really quite disabling. My patients who come to me with chronic daily headache usually tell me about 2 different types of headaches they have. One type of headache is very, very severe, and they often rate it as a 9 out of a 10 scale of pain or a 10 out of 10. And these headaches tend to be migraines. They're very severe headaches. They're located typically in the front of the head. During the migraines, the patients will sometimes say that their vision is blurry, that lights hurt their eyes, that sounds bother them. They feel sick to their stomach, like they're going to throw up. And for those migraine episodes, sleep is often helpful. But even after they get a full night's sleep, oftentimes they have a second type of headache, and that's a daily headache or background headache. Now, some doctors think that the severe headaches that these patients are experiencing are migraines, and the daily headache is more of a tension type headache. But if I ask my patients about what's the difference between the 2 headaches, they typically say that they're the same headache, only one is more severe than the other. When we talk about patients about ways to get better, it's a challenge because there oftentimes is not an easy answer. So sometimes we talk about things that make headaches worse, and sleep is one of the biggest factors. Many of our patients don't get enough sleep. So the typical teenager may need 9 hours or more sleep a night, and it's very difficult to get rid of those headaches without adequate sleep. We also talk about not missing meals, and particularly in the life of a busy teenager, they'll often miss breakfast. Usually we see the headaches most often during the school year, and that makes sense because the headaches usually are worse when the patient is very, very busy and when they're not getting enough sleep. And then, of course, we talk about specific foods and weather changes and hormonal changes and motion that can also make the headaches worse. For evaluation of these headaches, many of my patients will have an MRI scan of the head. Fortunately, that's normal. Sometimes we'll do blood tests looking at thyroid levels and other parameters. But in most patients who come to see me with daily headaches, all these tests are normal, and there's not really an adequate explanation for why they have the headaches. And so we concentrate on the treatment of the headaches, and probably the most helpful way to treat these headaches is to find a preventative medicine that can help with their headaches. Now, preventatives are medicines taken on a daily basis to prevent future headaches from occurring. The challenge is that they take a while to work, and they never really take away every single headache. They improve your headaches, but don't take away every single headache. And so there's lots of different choices for patients to use. Some of these choices are anti-seizure medicines like topiramate. Some of these choices are antidepressant medications like amitriptyline. Even though the patients don't have headaches because they're depressed, the amitriptyline still seems to work. And sometimes there are blood pressure medications such as propranolol or verapamil. Now, medications don't work in all of my patients, and I'd say about 1 in 5 patients who comes to see me aren't really helped by the medicines. And when that happens, we do try to think of alternative ways to treat the headache pain. We typically have patients work with a psychologist to learn biofeedback, and that's very useful in many patients. Sometimes we'll have our patients see a physical medicine doctor to work on physical therapy, because not only is there head pain, because sometimes there's back pain and neck pain as well. And sometimes we'll have our patients see an anesthesiologist, and they'll do trigger point injections, trying to numb up the areas that cause pain. So chronic daily headache is a very troubling situation. It occurs in patients who are predisposed to migraines. There's a wide variety of ways to treat the migraines, And there's many headache centers, including our center at Mayo Clinic, that can be helpful for patients.